Come in.
Hi, good morning.
Hey.
Good morning. My name is Nurse Mathis, and I will be completing your health assessment today. How are you feeling?
I'm okay.
Let me use some hand sanitizer, and I'll be right with you.
Okay.
Okay, so can you please tell me your name?
My name is Shalandra.
Right, awesome, Shalandra. And I do have your last name for video purposes. We won't give out her last name. Shalandra, can you tell me your date of birth
5994.
and your age?
I'm 25.
25. Awesome. Besides coming to establish care with the physician, is there anything else going on with you right now?
Not really.
So no illnesses, no colds, any pain?
No pain.
Okay. Do you take any medications?
Nope.
Do you have any allergies?
No.
What about to food?
No.
Medications?
Nope.
Childhood illnesses, have you had any past medical history?
No.
Are your vaccinations up to date?
Yes.
Okay, when was your flu vaccine given?
In October of 2019. I just had
perfect,
it.
you just had it, great. All right, family history, does your mother, father, or siblings have any medical illnesses?
Nope. They're as healthy as a horse.
Awesome. Social history, what's your occupation?
I'm a medical assistant.
Thank you for your service. All right, do you use any alcohol?
No.
Okay, do you smoke or vape?
Nope.
So no tobacco products?
None.
All right, do you live in a safe location?
Yes.
Any domestic abuse or violence in your household?
Nope.
Okay, do you have any kids?
No.
Are you married?
No.
Okay. You smiled too much when I asked you that one. What about your exercise habits?
I do a walk every day for 30 minutes.
Okay, you are doing awesome. Okay. And that is all of the questions I have. Oh, can you tell me your height and your weight?
I'm 5'7" and 175.
Okay. All right. With your permission, I'm going to begin doing your vital signs.
Okay.
And I've assessed my patient overall. She appears to be the stated age. Her coloration is normal for someone who is of African American descent. I'm going to take your vital signs, and then I will proceed to the rest of your assessment.
Okay.
All right, we're going to simulate taking her temporal temperature. Temperature is 98.6 degrees Fahrenheit. I have to take your blood pressure. Do you have a preference as to whether I take it on your left or your right arm?
Mm.
Thank you. You can relax for me. I'm just going to lift your arm once more. Perfect. Any history of high blood pressure?
No.
One 130/72. Great. I apologize. Just a little bit. And now I'm going to take your pulse. Okay. Thank you. I counted the patient's pulse and respirations, each for 15 seconds. I did not notify the patient I was going to be taking her respirations. Her pulse was 22, her respirations were 4, so multiply that by 4. Heart rate is 88, and respirations equal 16 for the full minute. You still doing okay?
Yes, ma'am.
Do you have any pain?
No, ma'am.
Okay. Alright, so continue with the rest of your assessment. Alright, so overall skin quality is good. I'm gonna look at your hands and your skin. Alright. You're nice and warm. The hair distribution is normal pattern. Skin moisture is also normal. I don't see any areas that are dry. I want to check for dehydration. Skin turgor is good. There was no tinting. There was a brisk return. And your texture is soft and smooth. That's awesome. And I'm just going to look you over really quickly, look for any lesions, any masses. Are there any areas of concern?
No.
Great. I'm going to start doing my scalp and head assessment. As I do this assessment, let me know if you have any discomfort, okay? So I'm going to start off, and I will not be taking down your butt, but I would be looking for any, as I'm palpating or touching, feeling for any lumps, looking for any lesions, especially if the person was bedbound. Want to make sure there's no flattened areas. I don't see any infestations. I don't see any lice. Let's see what else. The hair distribution is normal. I'm going to feel your cranium. That's also normal. Now I'm going to start here. As I press, let me know if you feel any pain. Here. No sinus pain? Mm-mm. Feeling your temporal arteries. Nice and elastic. Going down some. Can you clench your teeth for me? Good. Can you open and close? All right, so without you hitting your teeth together, just open and close for me. Open and then close. All right, any pain when you do that? Okay, good. Let's see. All right, can you please open your eyes wide? All right, close them. Can you smile? Can you frown? Can you puff out your cheeks? Perfect, thank you. So now we're going to resume with our visual test. Before we get you to stand up, I just want to look at your facial structure, your eyelids, and your eyelids appear normal. Good. Can you look up for me? I'm going to pull your down. All right, so your sclera is white, your conjunctiva is pink and moist. Any itchiness, any dry eyes?
Nope.
No irritation? What about watery eyes?
Nope.
All right, if I can get you to stand for me. So as we stand, I'm going to get you to stand right here, and we're going to pretend as if this eye chart is 20 feet away. And what I want you to do is with your hand cover one eye, and can you read the smallest line that you can see clearly?
LEFODPCT.
Awesome, so that means you have 20/20 vision in your left eye. Would you repeat the process on the other side?
LEFODPCT.
And would you repeat it for me?
LEFODPCT.
Perfect, if you'll have a seat for me. Alright, what I want you to do now is I want you to continue staring at that wall. And as you stare at the wall, I'm going to check to see how well light reflects off of your eyes. Just stare ahead. Good. Alright, and so that was a bilateral reflection. It was pinpoint. And now I'm going to check your pupils. I would cut off the lights, but for classroom purposes and video purposes, I'm going to keep them on. Good. I want you to look up at me. I apologize. Great. All right. Pupils are reactive bilaterally, a brisk response with a measurement of 2 mm's. And so now I'm going to check for accommodation. If you'll please just follow my pen light. I'm going to bring it in. Okay. All right. Can we try this once more? I'm going to have you. And just keep your eyes. Good. All right. And now we're going to check your cardinal gaze of vision. So we're going to go up. Okay. Just track with your eyes, not with your face. Any pain there?
Mm-mm.
Good job. So her pupils bilaterally were equal, round, reactive to light, and they accommodated. I'm gonna check your ears. I'll look at you. I love your earrings. So checking bilaterally, they're symmetrical. Let me know if there's any pain as I touch. Any pain there? Out over here. Okay. I don't see any drainage. If I did have my otoscope, I would be checking the eardrum to make sure that it was intact, to make sure that it was a nice pearly translucent color. Just checking for discomfort there. What about here? Okay. I'm going to whisper a statement to you. I'm going to close one of your ears and whisper a statement, and would you please repeat the statement? Okay.
You can't teach an old dog new tricks. Life is good.
All right, great. So no pain, no discharge. You were able to repeat the statement. All right, can I get you to look up at the ceiling? I'm going to check your nostrils. Good. Good. All right, septum's intact. I didn't see any drainage. I didn't see any deviations. Can I please get you to occlude one of your nostrils? Take a deep breath in. Good, and release. And if you repeat on the other side. All right, so no issues there? All right. I'm going to put on some gloves and we're going to look into your mouth. I'm starting off with an external assessment. I'm looking at your lips, and what I'm looking for would be any lesions. I don't see any dryness. There are no chapped lips. There are no abrasions on your mouth. That is awesome. And then we will check your inside of your mouth. Can you open up for me? I'm just looking around. All right, tongue is normal and symmetrical. Mucous membranes are pink and moist. Can you stick your tongue out? I'm not going to make you gag. I'm just, would you say ah for me? All right, so uvula does rise and fall, and the tonsils look normal. I did not see any signs of inflammation. So mucosa is pink and moist. The teeth and the gums, let me just check your teeth again. Open up for me. It looks like you had some dental work, but overall, no new cavities. When was the last time you went to the dentist?
June of 2018.
All right, so when is your next appointment? Are you going to schedule one?
Very soon.
Good. All right, so our hard and our soft palates are intact. Tonsils are normal. And the uvula did rise and fall. And now I'm just going to remove my gloves. And now, with your tongue, would you please press against my hand? Good. If you repeat the process on this side, good. Stick your tongue out. Good, it's midline. And if you have any questions about the statements that I'm saying, just let me know, okay? All right, so I'm gonna assess your neck, and if you just raise up for me. What I'm looking for would be any lumps, any deviations. Have you had any history of thyroid, any thyroid issues? All right, so I don't see any goiters, and I'm going to start off by testing your cervical nodes, and you can just sit normally. I apologize. Let me know if you have any pain or discomfort as I touch you. Good. No pain there?
No pain.
All right, I'm going to feel your carotid pulse. I'm going to feel this side first. Good and strong. Awesome, and now I'm going to listen. I'm listening with the bell of my stethoscope. And I do not hear any bruise, which is normal. Just palpate again. I'm going to feel for the borders of your trachea. I'm going to feel it's normal. And the thyroid gland also feels normal. I'm gonna put my hands on your shoulders. Would you shrug up for me? Awesome. And now back down. All right. Would you please look this way? All right. Head back straight. All right. And would you now look this way? All right. Would you lift up? And would you put your chin in your chest? Any pain when you did any of those motions? Any pain in the neck? All right. So the next part of the assessment will be me actually looking at your back. For classroom purposes, I will not be raising her shirt for the sake of privacy, but I will of course be listening I'll be listening to bare skin and also palpating or touching bare skin. Can I get you to turn this way just a little bit? Okay, thank you. All right, so I'm inspecting her back. I'm looking for any signs of discoloration, any masses or lesions. I'm not seeing any of that. All right. Symmetrically, her back appears symmetric. And what I'm going to do now is just touch you. Would you take a deep breath in and out for me? And release. Good. We have symmetrical lung expansion. When I touch you, I want you to repeat the word 99. 99.
99.
Good.
99.
Perfect.
99.
Great.
99.
Thank you. And again, there's no lumps. Tenderness, let me know as I touch your spine or your back if you feel any pain. I'm checking her spinal process, and so far she's pain-free, and I do not feel any lumps there. And now I'm just going to tap on you a little bit. I'm listening for differences in your lung sounds. Or lung feels, excuse me. Percussion is done. You're going to feel me thump you a little bit. Let me know if you have any pain when I thump you. Still okay?
I'm okay.
And now I'm going to listen to your breath sounds. When my stethoscope touches your skin, if you'll take a breath in and out. Okay? Breathe in. Good. Repeat. Great. Lung sounds are clear bilaterally. Alright, and now if you can sit in a normal position. And again, for the sake of privacy, I will not be raising her shirt, but we normally do not listen over skin. I would take my hand beneath her gown. What I'm checking for now is symmetry again, checking for discoloration or masses, and it is symmetrical. I see symmetrical chest rise and fall, and I don't see any masses, and the coloration is normal. You're going to feel me touch you. What I'm checking for is different pulsations, and it's also any masses. Just breathe normally. Okay. If the person did not have on a bra or a shirt, I put my hand here as well, feeling for any pulsations, masses, any heaves. And now apically, I will go under the breast to the 5th intercostal space, midline, and I feel for, again, any heaves, any lifts. Right. And that was a normal assessment. All right. May have to raise your breast tissue just a little. I apologize. Right. Feeling for the apical impulse. And now I'm going to assess your heart sounds. And I apologize, I'm going to assess your anterior lung sounds. Okay, deep breath in and release. Okay. In here. Great. Lungs are clear. Of course, without the bra, we'll go under and listen. I'll repeat on that side, then I'll go to the sides. I apologize for reaching over you. Deep breath in and release. And repeat over here. Deep breath in and release. Now I'll listen to your heart sounds. Okay. Good. Erb's point. Tricuspid. And now apical. Listen to the apical pulse for 1 full minute. Noting the regularity and also looking at my watch and getting a reading. Alright, so your apical pulse was regular. I did it for 1 full minute. Apical pulse was regular and your heart rate was 86. You still doing okay?
I'm doing good.
Alright, can you please squeeze my hands? Don't hurt me, just joking. And now I'm going to press against your hands. I want you to try to raise your hands against my force. And now I want you to try to lower my hands. Great job. Can you raise your arms up, straight out, and close your eyes? 1, 2, 3, 4, 5. There's no drift. You can lower your arm. Great. All right. And something I forgot to do earlier, backtracking. I forgot to check your capillary refill. Capillary refill is brisk and is less than 2 seconds bilaterally. And of course her hands are nice and warm. Now I want to check for any inflamed lymph nodes. I'm going to come over here and I'm just going to roll. Any pain as I press? Okay. And I don't feel any prominent nodules, which would be normal for a healthy individual. Great, thank you. Now if I can get you to take your shoes off, just lay back for me.
Yes, I am.
So much. Alright, so I have the patient's head elevated at a 45-degree angle. And if I can get you to please look this way, look toward the wall. And what I'm checking for would be any distension in the jugular vein. I can see the pulsation, but I'm not seeing any distension, which would be normal. And so I'm going to put your hands down to your side. I am raising the patient's shirt. What I'm looking for, is it okay if I raise it a little?
Yes, ma'am.
Okay, thank you. Okay. Alright, so now I'm proceeding to the abdominal assessment, and I'm looking for the contour, the roundness of the stomach area. I'm looking at the skin for any striae or discoloration. It appears to be symmetrical. The skin is intact. Let's see your belly button. There are no hernias. And I'm not seeing any pulsation. So we have a normal abdominal assessment. I don't see any scars, which would indicate a previous surgery. Well, listen to your bowel sounds. How are your bowels? Are they normal?
They're pretty normal.
When was your last bowel movement?
This morning.
Okay. Would not be listening over clothing normally, but I'm going to listen right now over clothing, starting off in the right lower quadrant. Good. Normal bowel sounds. Same. Good. Normal bowel sounds in all 4 quadrants, and now I'm going to listen to vascular sounds. Alright, vascular sounds are also normal. I'm just going to do some percussion. Just going to percussion's done. Everything sounded normal. I'm just going to feel your liver borders. Border, if you can take a deep breath in for me. Any pain as I press? Okay. Liver border appears normal. Now I'm also going to check your spleen. Again, no pain.
No pain.
And now what I'm going to do is some light and some deep palpation. So you may feel a little bit of discomfort, but if there's anything major, just let me know and I'll stop right there, okay? All right, going about. So far so good?
So far, so good.
Okay, now I'm going to go deeper, okay?
Okay.
You still okay?
Yes.
Alright, don't start giggling. I didn't know you were ticklish. Alright, great job. Alright, so for your inguinal or femoral arteries, again, normally I would not be assessing it over clothing. Is it okay if I touch you in this area?
Yes, ma'am.
Alright, so I'm going to feel for your femoral artery or femoral pulse. And I do feel it. I'm going to feel bilaterally. Now I'm going to check your inguinal area for any nodules. And I'll repeat on the other side. And I do not feel any nodules. So now we're down to our lower extremity assessment. And what I'm looking for is symmetry. I didn't see any deficits. We have both of our extremities, which is normal. We also have a normal hair pattern. Coloration is normal. I'm going to touch your legs. They're nice and warm. Can you feel me touching your feet?
Yes, ma'am.
Okay. Both sides?
Mm-hmm.
And so now I'm going to check your pulses. I'm going to check your popliteal pulses, which is beneath the knee. And I can feel them bilaterally. Your posterior tibial. And moving down to your feet. Okay. I don't see any edema. I would check capillary refill, however she has fingernail polish or toenail polish, so I can't see cap refill, but I can tell that her toes are warm and nice and pink, and I can see some pinkness to the tip, so we do have adequate blood flow there. Temperature was warm, toes, cap refill. Just want to go back and check your toes again. This is really important with your diabetic patients. You want to look between each toe. Alright, don't see any lesions, any areas of dryness, don't see any sores, and I'll also check the bottom of your feet. And I'll repeat it on this side. Now I'll sanitize. I checked your posture when you were sitting over the edge of the bed. It appeared symmetrical. You had a good posture. I'm looking at your ankles and your feet. They were also normal. Do you have any tingling or numbness throughout your body?
No.
Okay, so no pins and needle type sensation. Alright, so now I'm going to use an object to touch your body. I'm going to show you what if I can use the bottom of your hand, this is what the sharp object's going to feel like, and this is what the soft object's going to feel like. Okay, could you please close your eyes and tell me if the object is soft or sharp? I don't want to hurt you. Yep, that was sharp.
Soft.
Okay.
Soft. Soft. Sharp. 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 Soft. Sharp. Soft. Sharp.
Perfect. I'm going to have you just remain in bed for a few more moments, and I'm going to check your Babinski reflex. And I'm just going to take something against the bottom of your foot, and we're going to see how your foot reacts to this. course, if I had the proper tool, her toes would curve in, which would be a normal response. I'm going to sanitize my hands again, and can I please get you to sit over the edge of the bed like you were previously? We're almost done with the assessment. Alright, so I want to see if you get dizzy. So what I want you to do is close your eyes. I want you to tilt your head back. Alright, and now bring it back forward. Any dizziness? Okay. Maybe a little hard for you to do, but I want you to try it.
Okay.
If you can please extend one leg out just a little bit, and then with your other foot, if you can take it and run your heel to your shin or to your knee area and then back down. See if you can do it. Then up, perfect. And if you can repeat on the opposite leg. Oh, to be young again. Good job. So we are able to do the heel to shin. And if you can close your eyes for me. Well, let me tell you what to do first. I apologize. Open your eyes. What you're going to do is with your eyes closed, you're going to take your index finger and touch your nose. All right, so would you please try? And close your eyes. And now repeat on the other side. Good. All right, and now we're going to test your reflexes. I'm going to have a reflex hammer here. Start off here, right? If you can just relax, try to be just dead weight, just be limber, okay? All right, so we have good reflex there. I check here. Good. Good. Any pain when I did that? Let me check bilaterally. Reflexes appear normal. Just dead weight again. Just less of a response there. Try it here. Good. And let's try this one. Good. All right. Can you possibly just scoot back a little bit? Okay. Well, I'm sorry, so that your feet don't touch the floor. All right. So what we're going to try to do is try to elicit a reflex here. I'm going a little bit below your patella or your knee bone. Let's try this one. Not much of a response, but. Biceps, triceps, your brachioradialis, and now let's do your patellar and your Achilles. Good, good, done. And when I was doing your stomach assessment,